Good afternoon. Bonjour. Today is a very important day for those experiencing addiction and mental health issues here in our province. I first want to just take a moment to acknowledge three people who are in the room with me. And it's quite a little journey since I was first invited to the mental health conversation back in 2019, in late 2019, when the Premier and Minister Fleming invited me to this conversation. And so at that time, Hélène Delange, who's with us today, came with me at Social Development to help work the file. Annie Pellerin, who's the Acting Director of Mental Health Services at the Department of Health, and Mark Wise, who's also here, he's the ADM at Health. This has been quite a journey for all of us as we have strived to continue through our COVID challenges to move this file forward. And I want to thank them all today for all of their input, their passion, and getting us to where we are now. I'm pleased to be here this afternoon to unveil our comprehensive 5-year action plan. I want to personally thank everyone who has helped us get to this day today. The stakeholders, clinicians, clients, their families, and everyone else who has shared their stories. Thank you. For me, this has been a personal journey to get to today over the past 17 months. I clearly recall the day back in September 2019 when Premier Higgs asked me to take on this particular file. At that time, I was serving as Social Development Minister, and I took charge because mental health and addiction was becoming an increasingly prominent area of concern for our community partners and New Brunswickers. The rising level of mental health and addiction was alarming. We held our first roundtable with stakeholders meeting in November of 2019 and held another one in January of 2020 to lay the foundation so that we could all work closely together to formulate this action plan. In August 2020, we campaigned on a promise to deliver a 5-year addiction and mental health plan. In September 2020, when I was appointed Minister of Health, I brought the file across King Street with me. We all continued to roll up our sleeves to ensure we developed an action plan to serve as a framework to guide and align current vision, plans, and priorities, as well as to foster increased collaboration among stakeholders and partners in mental health. As we assembled this plan, we didn't wait. In fact, we moved forward by implementing some measures, such as expanding the mobile crisis services, bringing the Bridge the Gap online, opening a demonstration walk-in service clinic in Campbellton, where their success to date has eliminated their wait list and individuals have seen their needs met with a high level of satisfaction. I want everyone to know that this plan has clear goals and will have regular check-ins to ensure all partners are accountable. This 5-year action plan, overall goals are: improve population health, which will reduce risk factors and improve access to what is needed to be healthy. Improve access, faster first contacts, and reduce wait times for services. Intervene earlier, greater access to prevention and early intervention supports and services. Match individuals to care, easily navigated and more complete continuum of services and supports, and reduce drug-related impacts, communities that are less burdened by the impact of drugs, such as crime, illness, injury, and death. The 12 key priority initiatives over the next 5 years include implementation of walk-in addiction and mental health services across the province, addition of addiction and mental health resources to fill current gaps in staffing and prepare for increased demand from COVID-19. Implementation of an education, training, and knowledge transfer plan. Creation of various forms of supportive housing for addiction and mental health clients, including the implementation of a clinical consultation model for individuals requiring out-of-home placement. Implementation of a guiding document for upstream population health promotion and prevention in New Brunswick, including a New Brunswick-specific version of the Icelandic preventative model. Implementation of the Provincial Treatment Center for Youth. Implementation of outpatient withdrawal management services in partnership with primary care, and a review of existing detox beds to determine needs and optimal use. Develop a service model for individuals presenting with neurodevelopmental disorders. Initiations of a psychiatry resource strategy with a focus on recruitment, retention, distribution, and access. Implementation of regional inpatient youth psychiatric care where needed. Expansion of the RCMP Crime Reduction Unit, including resources from the Justice and Public Safety Safer Communities and Neighborhoods Unit, formerly known as SCAN. And implementation of overdose prevention sites. This year alone, 2021, we aim to implement walk-in addictions and mental health services, ensure adequate addiction and mental health staffing and space to fill current gaps, implement education, training, and knowledge plan, the RCMP Crime Reduction Unit expansion, implement overdose prevention sites, and implement guiding document for upstream population health promotion and prevention. In closing, I would like to say that this is an action plan that provides accountability for the provincial resources dedicated to addictions and mental health, with measures to monitor the benefits gained from it. And I've made this commitment with staff. This is not a plan that we will table and then look back in 5 years to see if it worked. We will be continuously assessing our situation, assessing the services that we are providing. And if we have to pivot, if we have to make changes, we will do it in real time. This is an action plan that will get results. Thank you. Merci.